Hello, and welcome to our annual MCPS Mental Health Awareness Week virtual resource fair. I want to thank everyone for joining us during this important discussion about mental health resources in our schools and in Montgomery County. My name is Dr. Christina Chester, and I am the Director of Psychological Services for Montgomery County Public Schools. As a school psychologist, I understand the need for mental health resources for many of our families who have students who attend our schools. In light of recent events in our schools and worldwide, it is critical to know how to access mental health services for our students. Talking about mental health is very important. We need to normalize this conversation in our community. We must all work to end the stigma and have open conversations about mental health in our schools and homes. Our goal is to have equitable access to mental health services for all individuals in our county, and this resource fair is a great step in helping our families and students know the resources that are available. Today, we will hear from several county and nonprofit agencies in Montgomery County that provide mental health support in a variety of ways to our students, staff, and families. We recognize that many of you may have questions about the information that is shared, and some have already provided questions in advance. Throughout the show, you can post your questions in the YouTube chat box. Our colleagues will compile the questions so that the panelists can respond to the questions in the second section of this program. To get us started, I would like to introduce our first panelist, Jose Delgado. Jose is the manager of counseling services for Every Mind. Welcome, Mr. Delgado.
Thank you so much. Good morning, and I appreciate you for having me here.
Can you share with our audience a little bit about what your organization does to support students and families in MCPS?
Absolutely. So Every Mind is a nonprofit agency that provides mental health and mental wellness support in the area. So we actually provide a wide range of services, ranging from crisis intervention, counseling, community education as well, where we provide presentations. And actually, we've been doing a program for the community that is mental health first aid. And so we're pretty much what it suggests, right? We provide mental health first aid. So it's just like CPR, but for mental health, which is actually very, very awesome. And so since we're talking more specifically about mental health this week, for the people within the NCPS community, I actually want to highlight 3 different programs, and those are Bridge to Wellness, Linkages to Learning, and also SCYS.
All right. Well, I know some of our questions that we have. So can you share with us, and because that's a lot, you have a lot of resources that are available. Can you give us some more details about, one of the organizations you mentioned is Linkages to Learning. Right. Can you share more information about that?
Absolutely. So Linkages to Learning is a fantastic collaboration between MCPS, DHHS, and some of the nonprofit agencies such as ourselves and some of our collaborators in the community like Shepherd Pratt, YMCA, City of Rockville. And so we, what we do is we come together and we provide different services for the community within MCPS.
All right. And then so Every Man, you're also supporting the Bridge to Wellness. Right. And so can you share more information about Bridge to Wellness?
Absolutely. So Bridge to Wellness, something that I want to highlight about this program specifically, which is, I think, amazing, is that there is either a Bridge to Wellness or a wellness center in every single one of the high schools within Montgomery County. And what that means is that every single student at the high school level in Montgomery County can get some level of support for mental health or mental wellness, which I think is fantastic.
Great. And that's a great way for our high school students to be able to just go and access these intensive mental health services that I know that they're looking for. Absolutely.
And one little bit extra about Bridge to Wellness is the type of services that we provide. And so we provide therapy services, both individual and group settings. We also provide case management, and oftentimes case management is done for the parents, but at Bridge to Wellness, we do it for the students too. They're getting older, they're getting more independent, and so, a little bit of extra guidance, it's always helpful, right, especially as they're trying to gain the independence.
Oh, absolutely, absolutely. It's very important for our high school students to learn, how to access mental health services, because eventually they'll be out of the home, and they have to know how to go and seek out this type of support themselves. All right, and so then can you also share more information about the SCYS program?
Sure, absolutely. So SCYS, we cover almost 40 schools within the area of Silver Spring, Wheaton, Aspen Hill, and Rockville. 3 of the schools that we actually service are schools where we provide dedicated therapy services. And so while we provide these dedicated services for these 3 specific schools, we can still provide it to the other areas, to the other schools within that area that I mentioned earlier. And something that distinguishes this program is that we provide therapeutic recreation services. And I think for me, that's a very exciting thing, because we provide mental health wellness and supports through recreational activities. You know, not every kid is ready, not every student is ready to sit across from someone and have that sort of formal talk about their feelings, about their situations, their challenges. And so this allows for a space that feels a little bit safer and a little bit lighter, you know, to communicate some of those things.
No, I think I agree with you, and I think that's a great option for especially some of our young kids that have another way. Like you said, instead of sitting traditionally in a chair, you can have another way of getting services and support.
Absolutely.
Oh, no, that's great. That's great. And then very quickly, I know Everymind also provides a little bit of support for, well, not a little bit, a lot of support for 988.
Yes.
And so can you share just a little bit of information about that?
Fantastic resource for anyone, anywhere, at any time, 24/7. Am I selling it? You know, good enough? Perfect. Right? It's free. Anyone likes free stuff, right? And it's also confidential. And so you get connected to trained counselors that can help you if you're going through a crisis. If you are just having a bad day, there's someone there available for you. And also, if you're wondering how to support someone else, you can contact this line, and they can also give you a little bit of guidance on how to support someone going through a mental health challenge.
That's great. And also, especially for our kids with cell phones, they can text too,
Oh, 100%.
correct?
Chat, text, call, all of that available for them.
Right. No. Well, and I want to thank you for coming on the stage, and that we will make sure that you'll be here again when we go to our Q&A section later on today. So thank you. So next, our Associate Superintendent of Wellbeing, Learning, and Achievement, Mr. Damon Monteleone, has an end-of-week message to celebrate another Mental Health Awareness Week. So let's roll that video.
Greetings. Today is the last day of the MCPS Mental Health Awareness Week. We hope you've enjoyed and have been enriched by the activities and information that we provided. Looking back over the course of the week, we had a fantastic time hearing from Dr. Jay Barnett as he talked to our students about strategies to improve their mental health and wellness. Our students actively engage in activities at their schools to promote wellness and to reduce the stigma associated with seeking mental health support. We heard directly from our students about their concerns and their needs, as well as the strategies they use to cope with stress and their feelings. And we announced a new partnership with the Jed Foundation, a national nonprofit dedicated to protecting emotional health and preventing suicide among youth. And while the week is almost over, helpful resources may still be found even after today on this website, mcpsmentalhealth.org. You're about to hear some of our amazing community partners share all the mental health resources they can provide to students and families. We encourage you to engage with our partners and to always connect directly with our office or your local school's well-being professionals, such as the counselor, people personnel worker, psychologist, and social worker. Finally, I want to thank you for taking time out of your busy Saturday to think about mental health and to focus on wellness. Thank you to our students for your support, and I hope that everybody enjoys hearing from our community partners and all the resources they have available. Thanks again.
Thank you, Mr. Monteleone. So my next guest is Lainey Park. Lainey is the program director of the Jewish Social Service Agency, or Jessa. Welcome to the Resource Fair.
Thank you.
All right. Now, can you share with us a little bit about your organization?
Sure, yes. Jessa right now has a partnership with MCPS where we provide mental health services, therapy in 39 schools throughout the county.
Great, no. And that with this, you know, in providing these types of services, and so I know, like, because this is your 3rd year that Jessa is providing support within our schools. And the 39 schools, that's a lot of schools that be providing support to our families. And so one of the questions that comes up about Jessa is, you know, like, do you have to have private insurance, or do you accept private insurance, or like how can individuals in our schools use, you know, if they have insurance or they don't have insurance, how can they get help through Jessa in the building with that and help to pay for it?
That's a great question. The great thing about our partnership is that we're able to provide services for every child regardless of insurance. So if they do have insurance, we do utilize that as part of our model. And if they don't, that's made available through our grant and our partnership.
No, that's awesome. So I mean, it makes sure that all students have access to mental health services, regardless of whether they have insurance or they don't have insurance. We make sure that anyone can get the support that they need. So that's good. And so and with that, what types of services, like what type of mental health services can they receive while working with Jessa?
So our social workers are able to offer therapy, and that's the bulk of what we offer. We also can offer psychosocial groups in the schools, and then I'm able to offer presentations and workshops for teachers and for parents.
No, great. So that way, so families can come and they can get different type of therapy services, like individual therapy for students. And do you all offer that? Do they have to go to like an off-site site, or can you offer? Does it offer in the building?
Right in the building. Yes, that's one of the great things about our program is that our team is right in the buildings, right in the schools, making it really easy for people to get services during the school day.
No, that sounds awesome. So then so let's say if I'm a parent, I'm watching this and I want my child to come and seek your service because my child attends one of the 39 schools. How can it be referred to one of your therapists?
Well, they begin by talking to their school counselor, and that school counselor is able to facilitate the referral and hand them over so that they can work with our team.
No, and that sounds awesome. And that, I'm glad to hear that this is a resource available for all students in the 39 schools you are all at, and that they just have to go and either talk to the counselor or someone at the school to help the process of getting referred for your support. And then you also said that you're providing, like, you can provide workshops for teachers and staff to help them as well.
Yes, I've been able to do that for teams of teachers, for PTA meetings, just whatever the school requests.
No, PTA meetings, that's great. So I make sure our PTA folks are sitting there watching, know you all can come out and provide support for them too. No, that's great. And I am very thankful for the partnership that we have with Jessa and the services that you all are able to provide within our school. So all that's great. So again, but I want to thank you for coming, and we'll see you later during our Q&A session.
Great, thank you.
All right. So next, I would like to present a video welcome message from the co-presidents of the Montgomery County School Psychologists Association, Ms. Janice Campbell and Ms. Ciara Caprera. Let's watch.
Good morning. I am Janice Campbell.
And I am Ciara Caprera. We are the co-presidents of the Montgomery County School Psychologists Association.
We are pleased to partner with MCPS on this year's Mental Health Awareness Week, including today's Mental Health Resource Fair. As the panel prepares to discuss mental health topics and answer your questions, we would like to share some of the highlights from the 2023 MCPS Mental Health Awareness Week.
As in previous years, we are pleased to provide students with opportunities to earn up to 9.5 SSL hours. Please visit the website and click the links for pre-recorded videos and recordings of the live events. Videos that provide SSL hours have an SSL tag next to them. Remember to complete the reflection in order to get credit.
In Montgomery County, we are fortunate to have a range of supports for students and families with mental health needs. In MCPS, we appreciate the hard work of school psychologists, school counselors, emergent multilingual learners therapeutic counselors, social workers, pupil personnel workers, parent community coordinators, and community school liaisons, as well as our community partners, including those working in our wellness and Bridge to Wellness centers in our high schools. It is truly through the collaboration and partnership of all of these mental health providers that we can equip our students with the skills needed to thrive.
Over the years, we have been able to build a library of videos about a wide range of mental health topics. On the website, you can find video presentations addressing a variety of mental health needs that reflect the rich diversity of the MCPS community. Videos are available that address the needs of many communities and mental health topics. We even have videos related to exploring school-based mental health careers.
Of course, we have to mention our 2 live events. The Waymaking Special with students that took place on Wednesday, and today's resource fair with the ability for community members to ask questions of our experts. Please use the chat during the live stream to send in your questions. We hope you will find the information useful. And enjoy the Mental Health Resource Fair.
I want to thank all of the Montgomery County School Psychologists Association for all of their work in creating and supporting this week-long event. We could not do this without you and all of your team members. So my next guest is Ms. Morgan Butler, who is the high school program manager for Our Minds Matter. Our Minds Matter is a student-led peer-to-peer club model designed to change school culture around mental health. Welcome.
Thank you. I'm so happy to be here.
Oh, glad to have you. So, can you share with us a little bit about what, the Our Minds Matter clubs do in our schools?
Exactly, yes. So in addition to having this dedicated team of 6 program staff supporting them, all of our MCPS clubs have access to our curriculum built of school-wide campaigns and club activities that are built from the 4 protective factors that we know not only promote positive mental health, but also decrease the risk of teen suicide. And those 4 protective factors are building social connection, maintaining pro-social skills, engaging in help-seeking behaviors, and also maintaining self-care and healthy habits. So those are sort of the main curriculum that our clubs get into, but that could be anything from bringing therapy dogs to the school, or even having a resource scavenger hunt, or even just having a pizza party and promoting kindness.
No, that sounds great. And, the ability for our high school and middle school students to be able to participate in clubs like this, is a great opportunity for them to learn more about mental health and help them to advocate for mental health in our schools. And so with that, because I think we're in, 17?
Yep.
17 high schools and 10 middle schools.
Yep.
And so let's say, I'm at a school that doesn't have an Our Minds Matter club. How can they start an Our Minds Matter club?
Of course. So the first thing that we encourage people to do if they want to start an Our Minds Matter club at their school is to send an email to program@ourmindsmatter.org. And hopefully, because we meet with you all on a regular basis, we already hope to have a connection with that person, maybe who is looking to support a club. So they can just send an email to us and we can either connect them to the identified adult sponsor that's at the building, or help them just start it up from scratch.
No, that's great. And I remember when we were starting and just trying to get the kids, and they were excited to go and I want to start this club, and they would contact us and we'd get them in contact with you. I think I just got an email from a principal to start a club in the middle school this week.
Yep, they're all hitting the ground running, and we can come in on the ground and support with the recruitment effort, if that looks like setting up a table at the school fair or something like that, or even facilitating an interest meeting. Those are all things that we can do to help start an Our Minds Matter club.
No, that's great. And, I'm really excited for our ability to have a student-led club that talks about mental health. So it's not just the adults kind of talking to you and saying, oh, do this, do this, do this, but kids talking to kids and sharing information about mental health resources. And plus, with all of the information, I'm going to be honest, for so many clubs, kids got to go and develop this stuff themselves, but you all give them to them. So it's easy. You have the resources, you have the materials, you have the things that set up what to talk about each month.
Exactly.
It's all pre-programmed and ready for kids to do this.
Yeah, we know how overworked that our school mental health teams can be with all of the caseloads and things that they have going on. So we want to make it as easy as possible. What we always say is we want to meet y'all where y'all are. So however y'all need to get started, we're just going to jump right in and support you guys with that.
All that is awesome. And so I keep saying that, but I love Our Minds Matter. I really do. I'm just glad we're glad that you're in the Montgomery County schools, and glad that you are working to expand so that, because my goal is for you all to be in all high schools and all middle schools in our county. But, for those of you who don't have one, we're working on it, and we're going to keep growing and expanding. So thank you again for coming and speaking with us a little bit about Our Minds Matter. And we will be seeing you in a bit, on the panel later in the second half of the program.
Thanks for having me.
All right. So next we have Tasia Colon Martins, who is an individual and family therapist with Thrive Behavioral Health. And so I am so glad to have you with us today.
So happy to be here, Dr. Chester.
All right. So can you share with us a little bit about what Thrive Behavioral Health does in our schools?
Sure. So Thrive Behavioral Health is an organization comprised of therapists that provide therapy, clinical mental health therapy to children, teens, and adults. But specifically with our partnership with MCPS, we provide therapy to elementary and middle school students during the school day.
All right. So, and with you, because I know we also had like Jess on here earlier with the services you all provide. So, but if I'm a parent, I'm saying, well, I can't afford this. How can I pay for the therapy in schools? Like, how does that work, in terms of billing insurance or if I don't have insurance, how does that work?
Yeah.
And what if I need help with that?
That's a great question. So you don't have to have private insurance excuse me, to receive services from Thrive. So we see students and families who have Medicaid and Care for Kids as well. So that shouldn't be a barrier.
All right. And I know with MCPS, like with the funding that we're supporting you all with, we're making sure that even if you don't have insurance or you don't have any of that, that, we're helping. If you as a family need help with co-pays, you need support, we're trying to make sure that all students who are in your schools, can get access to these mental health services regardless of the ability to pay.
Definitely. That's the goal.
Absolutely. And so then where in the county are you all providing services at?
We are in about 30 schools right now throughout the county. We are in different school clusters from Rockville to Springbrook to Northwood and various others throughout the county. So we're just glad to actually be in the school like during the school day.
No, and that's great. And so being able to provide this support in the county, and because you all are primarily, like I said, between Rockville, the Silver Spring area, and those schools around there, and hopefully, as we working on our budget and get additional funding, we can expand to more schools.
Yeah.
So, and also one of the things that, because you all also, I know Mr. Delgado talked earlier about Bridget Williams was in high schools. You all are primarily in elementary and middle schools, correct?
Yes, elementary and middle schools is where we are primarily partnered with. So it's great to have services for the little ones. And we have Spanish-speaking therapists as well. So just to open up the barriers to the families and communities that are out there.
No, that's great that you all have services in different languages, especially have services in Spanish, services in English. And so trying to make sure language is not a barrier
Not at all.
For getting access to services. So what types of therapeutic services are you all providing in our schools?
So we provide individual and family therapy as well. So usually, myself, I go into the schools, I pull kids from the classrooms, and we do individual services with play therapy, cognitive behavioral therapy, and we also include family as well, because that's definitely important on the journey to mental health wellness.
No, great. And in play therapy, so when I was a school psychologist, I used to do play therapy with my elementary and preschool kids as well. And so for our families who maybe don't understand what play therapy is, that's a great way, especially with younger kids, of getting them engaged, because they just can't sit here and talk.
Yeah. They might not have the words to know kind of what emotions are. So I do a lot of educating on what emotions are, how to name them, and it's easier to kind of use toys to play and really figure out kind of like social skills too. So really using what the level kids and students are at.
No, absolutely. And you have to do that. And so to really be able to help our students to understand, have a good emotional awareness, and being involved in these therapeutic services can help kids, especially if you have a kid who's struggling with their behaviors in the classroom, you have a kid who's maybe withdrawn and anxious and not engaging, not building friendships. One of the first steps is understanding those emotions and where you are, and then building on that to help them to, get to a better place.
this.
Yeah, I definitely agree, because kids don't know, younger students might not know what anxiety or anxious means, so kind of teaching them through real life examples. And it's great being connected in the schools too, because I get to have more direct conversations with teachers as well and say, oh, how is so-and-so in the classroom, which I know can be difficult with working parents and families at home.
No, this is good. And I know for several of our families, like they may have heard of Jessa, but maybe not so, because this is your second year in our schools.
Yes, we're so excited to be in this second partnership and to kind of expand the services that we have.
No, absolutely. And so then with you all, so let's say I'm a parent, I'm watching this and I'm like, this sounds great. I got a middle school kid that I think needs help and I'm assigned to one of your schools, you know, like, how do I get my child referred for your program?
Definitely, that's a great question. So we want all of, if any families or students are interested, to go to their school counselors and they will submit a referral to us. And then another way is also we can go directly to our website and then we can connect you with whatever school we are partnered with.
Good. So that way, so for our families know, if you want to come and seek this support, you can go like to the counselor or someone else in the school, like the principal or assistant principal, and get referred to your agency for support that is needed. And then also, like, are you all like, do you have to go to like an agency at night to see you, or can they see you in the schools?
No, they can definitely see us in schools. That is one of the easiest ways. That's what I love about Thrive, is we're flexible, that you can be seen in schools, and families don't have that barrier when it comes to like actually meeting, because you take your kid to school, you can come in and have therapy as well.
All right. And so what about if, you know, my child is sick and maybe they miss their services? Can they also get like teletherapy at home?
So we provide that as well. So we have teletherapy options. I did that just this past Wednesday for the no school day that we recently had. So seeing a couple of kids through telehealth definitely is easier as well.
All right. Well, I want to thank you for coming on and sharing some information about us, and we'll see you later on the panel.
Thank you. Thank you so much.
Thank you. So, before our next guest, and since today is our last day of this very special week, you know, I want to quickly review our highlights from this year's Mental Health Awareness Week. So let's show some of those slides now. So first off, we have a total of 9.5 SSL hours that secondary students could earn for participating in the events of this week. 1.5 of the 9.5 can be earned for watching this event and completing a brief activity online at the end of today's show. Our videos on the Mental Health Awareness Week website illustrate many of the supports for mental health that are available in our schools and community. You should check some of those out. And we have a range of mental health topics on the website that are available year-round for students, staff, and our families, and some are in multiple languages. As with last year, schools engage in in-person activities like those shown on the screen, including having therapy dogs, meditation classes, creating words of gratitude statements, and allowing time for students and staff to openly talk about mental health topics. All of these help support and promote mental health. Plus, we had 2 live events, including our first in-person event since 2019. These events allow participants to ask the experts and get their questions answered about the resources available and questions that they may have to help support themselves and family members. In addition to this week, all of the resources are on the MCPS Mental Health Awareness Week website and can be accessed throughout the year. And make sure to check out the MCPS Be Well 365 webpage, which is loaded with information and resources. So next, we want to welcome Manuel Calero, who is a therapist with behavioral health and crisis services at the Montgomery County Crisis Center. Thank you for coming on our show.
Good afternoon, Dr. Jessa. Thanks for having me today. Appreciate it.
All right, so can you share with us a little bit of information about what the County Crisis Center does?
Montgomery County Crisis Center is a 24-hour, basically a 24-hour ER for mental health services. So anybody can come in anytime. It's free of charge. We see children, we see adolescents, we see adults, we see seniors as well too. It's open to anybody in Montgomery County as long as you're a Montgomery County resident. We don't discriminate. You come in, you talk to a mental health therapist face to face, or we have telephonic services as well too. So someone can call in and talk to a live therapist as well too about any mental health crisis they're having. We also have the mobile crisis team where we go out to the community and we provide mental health assessments for people that are having acute psychiatric distress. We also partner with Montgomery County Public Schools, and we assess individuals that have been identified as being at risk of possibly harm themselves, either by parents, school personnel, school counselors, or peers. We have bilingual staff, bicultural staff. I myself speak Spanish. We have abilities to use a language line as well too, so we can kind of facilitate any type of language that the person may be having.
No, and that's great, and that is a great resource for our community. So if you have an individual who you feel like is in crisis, like maybe they're at risk for harming themselves, maybe they're having suicidal thoughts or at risk for harming others, they can come to the crisis center and get support.
Exactly, anytime. Again, it's 24 hours, 7 days a week. All they need to do is call or just walk in anytime. We're located actually right down the street from here, so pretty close by. Again, it's open to any Montgomery County resident anytime. Any parents can call anytime. Any questions they have about their child, whether it be son or daughter, exhibiting some type of behavior that they're concerned about, they can always call and talk to a live therapist anytime.
No, and thank you for that. And then you talked about your mobile crisis center, correct? And so how would somebody access the mobile crisis center?
Again, just call, and then there's certain criteria that we have to kind of assess to see if it's appropriate for us to go out. We do go out, some calls we go with police, some calls we go without police, depending on the severity of the situation, the acuity level of the client, so it really depends on that. We do provide the mobile crisis team to schools. I know a lot of school counselors have used our services as well too. So it really, it's a kind of a specific case-by-case basis, but I would just recommend for anybody to just call, talk to a live therapist, see what the criteria is, see if it's appropriate for us to go out.
Okay. And so if you have somebody who is unsure, maybe they're like, I don't know if I want to go and drive or take the bus to the crisis center, you can call and say, hey, is this something where we should come to you and talk to somebody live in order to get support about what the next steps is? Just because, some people are like, well, maybe, I don't know, should I go or not? There's somebody there that can 24/7 that can help them.
Yeah. People a lot of times have a little ambivalence about wanting to come in, talk to a therapist. Mental health has a lot of stigma, especially in our culture. Definitely, I would highly recommend just call, talk to a therapist. We assess the situation, see if it's appropriate for either you come in and we can talk on the phone, or we can send out a team to go evaluate the person at the house.
No, which is great, because I know a lot of our mental health staff do refer students to you all who are in need of help, who are in crisis while in the buildings.
Yeah, again, we have a partnership with MCPS where we get basically every student who has made any type of a comment regarding wanting to harm themselves, or if a parent are concerned about them, they notify the school will notify the parent, and then the parent will bring them down for a quick assessment to see if they're okay to go back to school.
Right, and I'm really glad to have you on the show. So especially to help to kind of, like you said, destigmatize, getting that referral to the crisis center. Because if the staff in our school are saying to a family member, hey, we think that your child needs to go, it is because their behavior is so extreme that either they're at risk of harming themselves or they're at risk of potentially harming others. Because we have elementary kids who are throwing chairs and so forth. They get referred to the crisis center to try to get support.
They do, yes.
And so we want to make sure that our families know what services and support you all provide, and hey, see a face with the name. It's not just, oh my God, I'm getting sent to this place, but you are here to help. You have services and you provide support in multiple languages to help our families out.
No, exactly. A lot of times parents are kind of maybe scared to come in to talk to somebody, or they'll get the referral. We get a lot of referrals from Montgomery County. We kind of see students all throughout ages, elementary school, middle school, high school. I think a lot of times parents will call and just kind of ambivalent or scared about what it's going to take to come and see somebody, what the process is like, so we can walk them through the process at any time and kind of reassure them that, hey, it's not something to be scared about. You can come in anytime and talk to somebody.
Right. No, and then we have a lot of kids, at our high schools, our middle schools, and even some elementary schools who are suicidal.
Yes.
And that we really need them to go to the crisis center to get this assessment to see, what support they need. And maybe a lot of times they may be referred for outside therapy. Sometimes they are referred to the hospital. So, but when you have a kid who's in this severe crisis mode, like they need help immediately, and that is why you all are here to provide that.
Yeah, I know MCPS has certain protocol that they have to follow as well too. So when the student, when school personnel finds out that a student has voiced some type of suicidal ideation or suicidality, yes, it's reported to the parents. The parents bring them in, and yeah, I think MCPS takes every threat seriously, as they should. You never know.
Absolutely, absolutely. We got to make sure that all students, stay safe, all the staff stay safe, and we're just so thankful to have you all as a resource to help us with this. So I want to thank you for coming and talking about what supports and services are available from the Crisis Center. And I know for folks who have questions, we'll see you later at the Q&A session at the end of the.
Will do. I'll be here.
All right, thank you. So. My next guest is Mary Allison Wheelock. Mary Allison is an adolescent substance abuse recovery specialist with Sheppard Pratt and works with the Recovery and Academic Program, or RAP, and at the Landing. So thank you for being with us today.
Thank you for having me. I'm happy to be here.
All right, can you share with us a little bit about what your program does and the supports it provides to our students?
Yes, absolutely. So as you said, the Recovery and Academic Program. So we are a partnership with Sheppard Pratt and Montgomery County Public Schools. And we provide academic as well as recovery support for MCPS students that are struggling with substance use disorders, but that have gone to treatment and that are looking for support, recovery support, and they're interested in recovery. And we tend to see that kids, when they do go to treatment, they fall behind in their academics. And so that's where we come in, where we have one-on-one MCPS staff and teachers and administrators that are willing to work one-on-one with them to help them get caught up and get some recovery credits while in a sober environment.
No, I mean, that's a great resource, and we're so thankful to be able to partner with you all and Sheppard Pratt in order to provide this recovery support for students who are ready to become sober and, stop engaging in using substances. And so, so let's say, I'm a student and I'm in this stage where I'm ready to start the recovery process. So how can I get referred to your program?
So it's pretty simple. So you only have to be referred to our program either through a personnel from Montgomery County Public Schools or through a mental health specialist, like the Crisis Center. And then we get the referral, and then we meet with you and decide if this is a good fit, and if it's not, then we can direct you to somewhere that we may think is better.
Okay, and so then with students that are in substance use recovery, can they attend the school, at the RAP, and then, what is the Landing, and how do students access that?
So that's a great question. So RAP is during the day, so that's the school part, and then the Landing is run strictly by Sheppard Pratt staff, and it is an after-school program. It's from school ends at about 3 till about 8 p.m. And it's just a bunch of kids that hang out. It's an after-school program. We have a clubhouse. We take them on field trips, help them with homework, help them with resumes, job applications. They get SSL hours. We do lots of fun things, or we just hang out at the center and watch movies, and we have a PS5. And so it's just a cool place to hang out and let kids know they can have fun while in a sober environment.
No, absolutely. And so for many of our students who are in a place where they're engaging in, recovery activities, they truly do need to be away from the school.
Yes.
Which is why we have RAP, where
Yes.
they can come, because it's hard when you're back in your, normal, environment, but that was the environment where you were engaging in using substances.
Yes, exactly.
And so being away with that helps them to, extend that time and get to a place where, when they're ready to re-engage. But as you're starting that process, it is important to have a place where you can get away.
Yes, absolutely. And you're around other people that are in the same mindset as you and that have been through similar experiences. So they're not alone. And there's plenty of staff that really love what we do, and we are there to support everyone.
Okay. And so then let's say you're a student who, well, maybe, I don't need the RAP part, maybe I'm okay, but I'd like to go to a landing, or, if you're at RAP, do you automatically attend their landing, or can you attend the landing? Because doing all those things sounds like a lot of fun. I know, like my teenager, I think would like that. Just to be able to, hey, I can go to a place and do these things and hang out. Or can I just attend the landing itself without attending RAP, or, the opposite?
So you can be enrolled in RAP, and then you have the option to stay for the landing, or you can just get enrolled in the landing, and mind you, this is all completely voluntary, so if you don't want to go, you don't have to go. And so we have kids that go to their home schools, so they'll be at their home schools. We'll pick them up after school, and we'll bring them back to the landing, and then they can do all the activities with us. But just because you're in RAP does not mean you necessarily have to stay for the landing, and you can just be enrolled in strictly just the landing.
Okay, so basically you can choose like your path.
Yes. Whatever fits that student's needs the best.
Okay, because I know, especially thinking about students that maybe in sports, maybe they want to go to a landing, go to RAP, but they can't go to landing because they're involved in the sports activity and need to go back to the school.
Yep,
so that could go do that but still participate in that. So there are options, and it is flexible for students to be able to kind of, like I said, choose their path, choose their adventure, like what would they like to do?
Yes, exactly, yeah.
Okay. And so then, so with this, is there a cost or fee for participating in either of these programs?
Nope, not at all. This is all completely free, and we like to bring in providers and stuff like that, and so all of this is free of charge. All you have to do is be enrolled in an MCPS school.
Oh, great. So, especially for our families who may be watching, or students who are watching who then want to, say, well, maybe I'm in this place where I need these recovery services, and that they can just talk to the school counselor or another staff member in the building, like they're an administrator or maybe the school psychologist. I know a lot of times there are high school kids who are participating in this, correct?
Yes, high school aged, yeah.
Okay, and so they can just go be referred and then find out more then about, how to join and how to get, become a part of this.
Yep, exactly. We'll reach out to you and schedule a screening, and we'll see where it goes from there.
All right. No, and I want to thank you for coming on. This is all very important work.
Thank you.
And, definitely support, as we've been hearing so much about students and individuals who are in need of recovery services throughout our community, especially as, we talked about issues with fentanyl and so forth. Yeah. The importance of having programs like this is even more. So, as the more and more we learn about, the impact of substance use, for our students throughout the county. So thank you.
Yes, and thank you as well.
All right. So, and we will see you on the panel next. And so next we wanted to show our audience a resource on our website. It is the Be Well 365 webpage. This website is loaded with different resources and information to help you find your school-based mental health provider in your building. These resources also focus on helping students develop a greater sense of well-being and establish and maintain healthy relationships, manage stress, engage in restorative practices, and become resilient human beings. As we approach our Q&A session of the show, I wanted to give you, once again, the information if you'd like to submit a question. If you are not watching via YouTube, please go to the MCPS YouTube page, click on this live stream, and you will see the chat box where you can send us a question. If you are already watching via the MCPS TV YouTube channel, then you can add a question in the chat box. We will try to get to as many questions as we can in the Q&A session. So thank you to all of our panelists for sharing with us today. All of today's panelists will be with us in our Q&A session, which is moments away. But first, I want you to watch a short news story that MCPS TV produced to kick off, promote, and highlight the week, which this year included numerous hands-on activities that schools created. Let's take a look. This week we're celebrating Mental Health Awareness Week, and it is so important in our schools because we really want to try to end the stigma around mental health for all of our students and staff and our community members.
3, 2. Today's coping skill is brought to you by me. Hi, Sheila. I think mental health should be celebrated because it's as important. It affects our physical health. It affects communication with other people.
At Cloverly this week, we have a variety of activities planned. Our counselor, Ms. Glazer, at recess is doing a number of different activities for mental health awareness, helping people become aware of it, helping people understand that it's okay. The more we're open about it, the more people understand that there are ways to cope, to help yourself feel better, the better off we'll all be.
When I get upset, I breathe in and then I calm down.
Okay, so deep breaths.
Good morning, Richard Montgomery Rockets. Let your voice be heard. It's something we say to people all the time. Then you wonder, do they really mean it? Do they really want my voice to be heard? This week, the answer is yes.
I'm one of the students on the mental health wellness team, so what we do is we plan the activities to give our staff a little idea of what's good for the student body.
We have stories of encouragement on the morning announcements, and we also have therapy dogs, and we'll have Chalk It Out today too, where students can just write encouraging messages and draw pictures on the blacktop outside.
We have the coffee bar day for our staff members too, to also really include them in our mental health wellness week.
Academics are very important, but I think it's important to remember that we should take care of our mental health as well too.
All of our schools have activities where they're participating, individually. We also have our Waymaking Special on student mental health, where we have a dynamic speaker coming and a student forum to talk more about student mental health. And then on Saturday, we also have our annual Mental Health Resource Fair, where we have community agencies coming in to talk about mental health resources in our schools. That was great coverage, which highlighted the week, especially the great work that our schools did in bringing fun and engaging mental health activities to our students. That really brought our week to life. Thank you to our schools, the PTAs, our mental health professionals, and administrators for making that happen. Now, let's get to your questions. So, thank you again to all of our panelists for joining us today. There have been a lot of questions coming in, and we might not get to all of them, but let's get started. And once again, if you'd like to submit a question, go to the MCPS TV YouTube channel, join the show, and use the chat feature. So now, for our first question. And my first one I'm going to send to Mary Allison. So what do I do if I think a friend has a substance use problem?
That's a really great question. I would definitely suggest reaching out to a trusted adult or possibly maybe a counselor or a teacher. If you're close with their family, maybe one of their family members. And just have that explored. I know it's a very sensitive issue, and especially teenagers being teenagers, it's difficult. But having an adult kind of supervise that and take charge of that would definitely be the best. And also be supportive and understand that what they're going through may be very difficult. And so just keep that in mind. But the fact that they're recognizing that maybe their friend might have a problem means that you're being a really good friend.
Right. No, thank you. And so in this one, maybe there may be several of you that might be able to answer this one. So, from one of our students, so what is the best way to balance everything so we don't stress out, at all, and we can have, like they said on here, a fair schedule, or, trying to basically balancing school and life. So what do you all think, what are some things that you all can do?
Well, I think something that we like to tell our students, and this is even a mantra that we have amongst our staff, is that you cannot pour from an empty cup. So always making sure to check in on yourself first and what your personal capacity is. And I know that's easier said than done, especially being a high schooler right now. I mean, we were just talking with some students who are working on common applications already. Thinking about college, you want to have all these extracurriculars. But really just remembering not to overextend yourself in those areas that you do find like real passion and interest in. Commit to those and start one at a time first.
Okay.
Yeah, and if I may add to what you just said, that self-advocacy piece as well, right? And so the role of a supporting adult is, to empower our students, to empower our youth, and we're setting them up for success, right? And it's okay to help. It's okay to give advice. It's okay to provide that space where we can talk about it. Hey, this is how you can advocate for yourself. Hey, this is causing stress in your life. Here's something that you can do about it. This is how you can communicate it, let's say to your teachers, to the administrator, to the counselor, whoever it is that can help you make a difference in your life.
No, and thank you, and all that's great. And so, we really got to make sure our students are balancing, what's going on within their lives. And like you said, because you're right, they cannot pour from an empty cup. So, absolutely. And so on here, it says, what can you do if someone can't afford therapy and the school counselor is busy? So how can I go and seek mental health support?
Well, definitely with Thrive anyways, you can go directly to our website and we have a submit referral link right on there. And so it has questions of like what school you're at. So once you put in your school, even if your school counselor is busy, we can pair you to the Thrive therapist that is directly within your school.
Okay. Anyone else? What about, if they're in one of your schools?
Right, and if they're in one of the schools that we serve, they could go to their school counselor, they could go to their parent who could go to the school counselor or their teacher, and that school counselor will facilitate that connection and allow them to have access to more support.
Okay, all right. So what about, for our high schools that bridge the wellness? They're like I tried to go to the counselor and they can't do it because they're writing letters of recommendation for college right now.
Right.
How do I get help?
Yeah, so honestly, one of the things that, and this also applies for linkages and SCYS, it's like, if you don't know whether your school has that program and those types of support, you can reach out to your counselor and say, hey, do you have any mental health support, any mental wellness support? I'm going through a tough time. Is there someone in the school who can provide, that dedicated help for me? And so specifically for Bridge to Wellness, we have offices, we have a suite in each one of the schools. And so you can either go to a suite. Usually it has, a letter, in one of our schools, for example, there's like a big mural that says, we're here. So, it's pretty obvious, so you can't miss it. But also you can go to the school counselor and you can say, hey, can you connect me to the Bridge to Wellness people? But we're also very friendly, so you can knock on the door and we'll open it for you.
All right, so basically I can just go, I can walk right on down to the hall and go and seek it out myself, some self-advocacy.
Yeah.
There we go, okay.
And as well, Shepherd Pratt, we do have, very close to the, to our center at RAP, we have a outpatient mental health clinic. And so you can walk in, fill out a form, and then a caseworker will get back to you and figure out what type of therapist is best for you. And you can get connected that way. And they are bilingual, and it's free of charge.
All right. No, thank you. So we got services. That's one of the big things. We want to make sure that our community knows we have services that are available. All right. And so on here, they ask, if someone is depressed, what should we do to help them?
One of the things I love about working with Our Minds Matter is the amount of resources that we're able to actually vet and then recommend for our students. And so we have recently partnered with the Born This Way Foundation on their Be There certificate, which is a free, accessible, self-paced digital mental health literacy training that anyone can take if they want to learn what sort of best practices to take to support themselves or a loved one who might be experiencing a mental health challenge. The certificate encompasses 5 golden rules that anyone can learn and then apply those rules again to support anyone who might be going through something.
Okay. And so what about if I'm sitting there, I'm at home and I'm feeling this, so can I call the crisis center and talk to somebody?
Yeah, definitely. And I know there's a teen chat line also, through Every Mind also. So yeah, they can call anytime and talk to somebody. I would, again, kind of echoing what everybody else said as far as searching for mental health services. A lot of times, maybe if you find the school counselors too busy or they don't have time right now, talk to a parent, right? I think a lot of times parents would be shocked if a kid says, hey, I need therapy. I think a lot of parents want to push it and say, they kind of volunteer that, hey, hopefully Johnny or whoever will accept treatment services, so they'll be shocked probably if they see their daughter or son actually saying, hey, mom, dad, I think I really need to talk to somebody. So yeah, I would say definitely start with your parents, start with your family first if you can.
Right. No, and these are all excellent things. And, you know, and as we're going through here, you know, I want to make sure to remind our audience that, you know, while, yes, we have the school counselors in all of our schools, we also have school psychologists in all of our schools. We also have social workers that are in our high schools and in a significant amount of our middle schools, and now some that are also supporting our elementary schools. So, and we also have ETCs, the EML therapeutic counselors who support our newcomer population, and they speak multiple languages. And so we have a lot of mental health resources that are available in our schools and in our community, and those we partner with in our schools to provide support. So there's a lot of different people to go to and seek out this support if you need it. It's just a matter of, you know, the first step, finding that person to go forth and get that help. So that's good. So then, let's say, how long does it usually take to feel better once you start mental health treatment?
I can go for that. So it's a tough question, right? Everyone's progress, everyone's recovery, everyone's healing looks a little bit different. And so sometimes it would be 6 months to start seeing noticeable results. Sometimes it will be 30 minutes. And so I think the important part here is like changing the perspective, right? What are we looking at ourselves, and like what are we trying to improve? What are we trying to heal? And so sometimes changing the perspective of like, yeah, sure, maybe I want to be able to sit in front of a class and be able to give a presentation and have zero anxiety, let's say. Maybe that's someone's goal, right? But maybe we should look at the little steps. Okay, well, can I walk across this classroom without feeling levels of anxiety that are hard for me to manage, right? And so that's a success. That's already progress. And so sometimes changing, you know, that perspective and how long it's supposed to, you know, take for us to get better, that could help us feel better, actually.
Yeah, I agree. I always like to talk to my students and families and let them know that mental health wellness is a journey. And so, you know, like we've already discussed, like there are little steps that we can take to kind of manage the day-to-day stress, but really it's a forever process and journey that we're going through, even as adults, right? That we carry these skills through us. And even what I appreciate about Thrive is that, yes, we work in schools, but we are continuous year-round. So we're lucky to have this partnership because we have the school as a place where therapy can continue even throughout the summer.
No, and that brings up another question that came up. So then how long can a student see any of your therapists?
With our program, we're set up to do what we call a solution-focused short-term therapy. So the initial course would be 16 to 20 weeks. And we do have some kids that, you know, they maybe make some progress but still need support after that. We're able to extend. But we really look for that so that we can continue to make room and be able to serve all of our kids.
Okay. All right. And so do any of you, I know because for some kids, you know, they need that short term. And most folk, you know, 16 to 20 weeks is probably about all that they need. And then, you know, like going to the doctor and you have a medical issue and you go and you get treatment and then it's done, right? And then you move forward. But there are some who may need more long-term help. So,
if I may, you know, I like what you said about like it being a process, and with mental health you really have to trust the process and understand that no one has walked in your shoes. So you know you can't really compare your mental health journey to anybody else's because they have not been where you have been, and it's very individualized. And so that's what I really like about Wrap in the Landing is we meet the students where they're at, and we want to make all of the students, not just Wrap and Landing students, but all of the students, you know, as successful and as happy as they possibly can be. But trusting the process, understanding that not everybody's struggles are the same. And so it may be longer for some, maybe shorter for some. But it doesn't mean that it's taking longer because you're more difficult or anything. It's just, it's different for everyone. But trust the process.
Okay, all right. Now, I know it says on here, there have been a couple of questions in the chat about knowing who your school therapist, counselor, and school psychologist are. And then one of us goes in here, like, how do you know who your school counselor is if you're a younger student who may not know? And how do you know who your school therapist is if you are in middle school? So now for some of this, I will say, especially for like our elementary school kids, even our middle school kids, like you can go to the counseling suite, you can talk to your teacher, and your teacher will know like who to go to if you, let's say I'm in second grade and I've never met my school counselor before. I can go and directly ask the teacher, can I go see the counselor and get a referral to go see that individual in your building. The same thing with, in the middle school, they have a counselor suite, and you can go there and find out who your counselor is if you don't know, or who are the other mental health professionals that work in your school, so you can go out and see them. And so for some of the agencies, especially the ones that work in our elementary school students, and so going into a little bit, so if I'm elementary school kids, and let's say I want to go see the therapist at Jessa, how do I do that?
Well, you could talk to any trusted adult in the building, and they're going to be able to tell you who your school counselor is. They're usually assigned by grade. So there's anyone in your front office, in your counseling office, will be able to direct you to that person, and that person will be able to connect you to us.
All right. And the same thing with Thrive?
Yeah, similarly. Definitely go to your teacher first. Since you already know them, you see them every day. Go to your teacher, ask who the school counselor is, and they'll definitely let you know. Even I have some cases where the younger students, their parents have talked to the school counselor and connected them to services, but the students themselves, the first grader, second grader, kindergartner, doesn't know who the school counselor is. So I've done like little walk-ins and said, hey, I'd like to introduce you to so-and-so, and just creating that relationship within the school as well.
Right.
And for us, so through the Linkages program, right, we are in the middle schools and also in the elementary schools. And so oftentimes I think this resource is a little underrated, which is our own peers. I mean, if we have friends in different grades, we can ask, hey, like when you were in, the fourth grade, like who was your counselor? Or sometimes also like especially if some of the students are a little bit more comfortable with technology, sometimes the school website has that information on there as well. So,
Okay, good. And so then on here, a question for Manuel. Can kids go to the crisis center on their own, or do they need a counselor or a parent to take them?
So technically, we would appreciate if a school counselor made a referral and the parents are there. Obviously, whenever you work with children, you always involve the family because we're looking at family dynamics issues. So hopefully if the if the child or the student wants to talk to a therapist, I'd recommend they talk to the school counselor first. School counselor can make a referral, talk to the parents, have the parents bring them in. When they come in, we'll talk to everybody as a unit and then individually as well too. But I think there is a certain rule where we can see maybe on a one-time basis, depending on for a safety assessment, there's got to be some type of suicidality involved. We can see adolescents, maybe I think it's 14 and above on a one-time basis. But we're still going to just know that we're still going to involve parents or legal guardian because we do think it's important for them to know, what's going on with the child at home.
Right. Okay. No, that's good. And so then also, how old do you have to be to go to the RAP or to landing?
So we technically start in middle school. We haven't really gotten a lot of middle schoolers, but we start at about age 12. However, right now it's all high school aged kids. So this year and last year we have dealt with 13, 14, 15, 16, 13 to 18 pretty much. But we do help and service kids that are in MCPS middle schools.
Okay, all right. And then what are some coping strategies that we can use to help ourselves?
I think that depends on the person. I think it's different for everyone. What works for you may not work for someone else. And so it's a matter of finding what calms you down, what makes you feel good in a healthy way. It could be playing with your pet. It could be watching a funny movie. It could be taking a bath. For me, it's cleaning. I know that's strange. I like cleaning. So that calms me down. And it's kind of like trial and error. Like you kind of have to try different things. It's not going to be like, I'm going to try this, this coping skill is the one. It's not going to happen that way. And it's different for everyone. Everybody has different coping skills. Maybe a face mask, getting your hair done, nails done, taking a walk, things like that.
All right.
Yeah, I was going to say, I think that's the beauty of supporting our clubs and knowing that they are trying to implement these unique efforts that are specific to their individual school building and community, because we have some clubs where their idea of a calming activity is making like lavender scented cloud dough or even painting pumpkins. And then we have some of those more, I would say, clubs that are focused on advocacy, and their idea of like self-care is like doing a school-wide campaign and getting everyone in the building involved. So it's a huge spectrum, and I think it's whatever you feel comfortable and passionate about, and what, again, fills up your cup.
Yeah, and I think, just kind of following on this path that my colleagues have shared, if you think about a coping skill is it's something that helps you feel better. And so it distracts your mind. And so a rule of thumb that I like to always share is if you can do something that engages you, that you enjoy, that you like, it will distract your mind. If you put me to read a book, if it has pictures, I'll get distracted. If it has a lot of words, I'll be like, okay, is there an audiobook for this thing, right? Then again, going back to different things for different people. And so if it distracts you, if you don't think about things and you're just thinking of the thing that you're doing, that's probably a good coping skill for you.
Okay, all right, no, that's good. And so then also, why is there stigma around getting mental health support?
Well, there's long been stigma around that, and fortunately, and due to things like the clubs, we've been able to address that stigma in a lot of ways, and kids are feeling more comfortable being able to ask for help. But that just comes from misunderstandings about mental health and maybe feeling like it's something that couldn't get better or something that might be permanent. And we know now that that's not true, that if kids have access to help, if they have access to support, that they can get better and they can begin to see the sunshine again.
Okay. Anyone else want to share?
I'll talk about the Latino culture. Obviously, there's a lot of stigma in our culture. So a lot of times we will get parents of bringing their kids, and we'll have to educate the parents more than anything. The kids born here in the U.S., I think there's a lot more awareness nowadays. So it's being talked about, this forum, and you do Mental Health Awareness Week for that same distinction as far as educating people, letting them know what services are out there. So it's not it's not taboo to kind of look for services. A lot of times we spend a lot more time educating the parents because they're from an older generation. Things weren't talked about, things were stigmatized, things were looked at. Someone's crazy. We know that we've come a long way from that now. It's still existent, but I think there's a lot more education nowadays, more awareness. So a lot of times we spend more time talking to parents, educating them about what resources are, letting them know what depression is, what anxiety is. It's not something that people are just making up. Letting them know why someone is self-harming, or what's what triggers lead to that. So it's a lot of education. So yeah, hopefully the barriers will go down slowly. So I think definitely something like this is definitely helpful. I think it's a right step.
Okay.
I think just in recent years, we have begun taking a more holistic approach to mental health also, and acknowledging that mental health is just as important and connected to our physical health as well. So it's not just anxiety and stress management, it's also drug prevention, it's also dealing with things around like houselessness and things like that. And so I think having these conversations and getting sort of everybody in the room to talk about these things and collaborate on how we can best serve students is helping to curb some of that stigma as well.
Yeah, and I think also with the schools, like in some of our linkage sites, for example, when I was practicing as a therapist, we had the administration getting involved in school marches and getting the linkages office involved, right? Because in there we have case managers, we have therapists, we have people who provide school-wide support with different workshops and presentations, and so we know it's a collaborative effort also in the school. And for me, I'm very happy to see that there is active work in the schools, not only from the teachers and administration, but also from the students. Like, I will walk around the hallway, oh, that's my therapist. I'll be like, this is so refreshing. This is great. Yeah. So, good job, youth. Yeah.
I agree. Culturally, I think one of the common phrases that I know I've heard in my lifetime is, what happens at home stays at home. And so that things need to be hidden has really caused us to not even know what distress or kind of mental health looks like. And so we all have mental health. And so to keep ourselves healthy, talking about it, and like everyone has said, having events in a week like this to really bring it more open and kind of normalize that we all have different things going on. And so finding ways to make ourselves healthy is really the best way.
No, absolutely no, and thank you all for all that, because the there is stigma in our communities, and in order to help our students to get the support, we have to work with our students and our families, as you all stated, to help them really to understand, what the stigma is, and that, getting mental health treatment doesn't mean that your child's going to go into this institution and be locked away. Our society does not do that. And so, but we have to understand, in other cultures, in other countries, sometimes some of those things are happening. And then especially families who have recently arrived, here in the United States, they may not understand what our mental health system here is in the U.S. and how to get support. And that, it involves more than just going into the padded room, what things that are there and that are your resources, because I keep hearing a lot, your resources don't cost a lot of money or they're free. And so, it's an affordable way of just like going to the doctor because you're having an asthma attack, or like me, I got to go to the doctor because I'm diabetic. Going to see a therapist should be just as easy a thing as doing any of these other stuff. Absolutely. And so, because your mental health is equally as important as your physical health. The brain is a part of your body. I say this all the time. It is an organ in the body, just like anything else, and you have to treat it. And so, in that, having a mental illness doesn't mean that it's with you for the rest of your life. And so we really, that destigmatization is so important. And I just thank all of you for all your comments around that, because this is, like you say, this is why we're having Mental Health Awareness Week, right? Yeah. And so to try to help in the destigmatization. All right, and so we have a question here. There's a couple questions in chat about what can a parent do if their child does not want to engage in therapy or mental health programs, or they're being stubborn about their problems?
Well, I can start with that. We serve elementary and middle school kids, and that often happens with us, that the parents or someone else in the child's life decides that they need therapy, and they're hoping that will be what helps them get better. And our therapists will do their best to really build a connection and to begin to build some, healing, but also kind of problem solving with the youth. Like trying to figure out what might have brought them there. Every once in a while, we've discovered that that's not the right intervention at that time, and that's okay too. So we really, I try to encourage that they would, be able to take a step away, feeling that therapy is always a safe place that they can return to when they're ready. And then we're able to work with the school counselors and other people in the school to look at other interventions like positive youth development. Can they get involved in more things? Can they be connected to more of their peers? What might be another approach that works right now?
Okay. Right. So then another question on here, they said, seems like there are a lot of programs that are offered. So, and which one is the best for how to deal with bullies? Aside from reporting, what else can the bullied student do for him or herself?
So I was actually thinking about an example with your previous question. We hear a lot of times from students that are working through recruitment, we're having trouble engaging other students in our community. They don't want to talk about mental health. They don't want to come to the club meetings. And one of the things that we first do to help troubleshoot that is ask, how are you marketing the club? How are you actually engaging or talking about mental health? There's a high school in MCPS that actually doesn't use the Minds Matter name. They're actually the Hero Club, and they are all about anti-bullying prevention. So that is one way to still engage in the conversations around mental health without using some of that maybe harsh language that some of our students are used to feeling shamed about, or are just feeling that stigmatization. So I think it's interesting what students take with the club and the curriculum and the direction that they choose to go. And again, I think that each school is just very unique. And I would say for any student or teen who is experiencing bullying, I would definitely say reaching out to a trusted adult in the building, or even a close friend, maybe tagging along with that friend to a different club or sport or extracurricular activity that they enjoy, and immersing yourself in maybe a different community and finding your own community, even building your own community if you're not really finding something that aligns with what you're hoping to get out of the experience.
Mm-hmm. Yeah, I absolutely agree with what you said. And in addition, I know that MCPS does a lot of restorative justice, and that has been proven to really, really help because you're talking about the problems and coming to a resolution that works on both ends. And that has also been proven to be extremely effective. And so if the participants are willing and comfortable with doing that. So that's also an option that you could also ask maybe a counselor about.
Okay.
I'd say at our place, we get a lot of referrals from school counselors regarding bullying also. And I know MCPS has a bullying form that we fill out. Personally, I filled it out 1 million times. And I see that it gets somewhere. I think it kind of goes through the appropriate channels through the administration. And I highly encourage parents to fill it out. I'll fill it out for them if I see their children there at the crisis center. And I do see that it makes some type of progress. Kids have come back and said, yeah, it's kind of helped out. So again, I think letting them know that, hey, you don't have to suffer in silence. Let someone know, let a parent know, let a teacher know, let any trusted adult know. And that form is there for a purpose, right? I think MCPS takes it pretty seriously.
Oh, absolutely. And as you said, we do have an online form that students, their family members can fill out. It is in multiple languages. Mm-hmm. And so they can fill out the paper form. There's an online form where they can just submit it online. I don't have to worry about writing it up and turning it into somebody. We also have an anonymous tip line where the Safe Schools tip line, the Maryland Safe School tip line, where you can go on and submit if you feel like you've been bullied as well. So there are staff members in our schools who can help and support through this process. So, and I know, like, if you are being bullied, we can make referrals if you are in need of mental health support from any of your agencies to provide support for the victim of bullying, but also the bully themselves. Because a lot of times the bullies are going through stuff too, as to why they're bullying in the first place. Mm-hmm. And so what can we do to support all parties involved in this? So that's good. So, and then one of the things it says, like, if you talk to your counselor about something, does it go on your permanent record? And I can say, no. So talking to the counselor is confidential. Yes. And I know we have a lot of kids who are worried about that. Like, oh, if you make this referral, it's going to go on my CUME record and the colleges are going to know about this, or the counselor is going to put in my letter of recommendation. No, that does not happen. And so with your agencies, can you talk a little bit about the confidentiality process?
Sure, yeah. We're held to HIPAA, which is a rule that guides confidentiality in the mental health field. And it means that when we're working with kids, we do have to have the caveat if child safety is ever on the line, and we let them know, if we think you're not safe or another kid's not safe, we might need to work with others to make you safe. And at the same time, what you tell us, everything else, we can keep completely between us. We don't need to share it with the school. We don't need to share it with parents if they're safe. We do, encourage and to work towards a place where we can bring the parents back in and create some healing within the family.
And I believe we're all mandated reporters. So, like you said, unless there has been mention of you wanting to hurt yourself, hurt someone else, or if you have been hurt in the past, that's grounds for reporting. And when we report, it's not like we're trying to take you away from home or split up your home. That's the last thing we want to do. We just want to make sure that everybody's safe. And I know personally, when we meet with the students for screenings, when they come into our center for the first time, we actually speak to them by themselves, because I know kids open up more when their parents aren't there. And so we tell them, you can be completely open, and we're not going to go and tell mom, unless we do have to report something. But, you can be completely honest. And that's the best way to get help, because if you're not telling the whole truth and exactly how you feel, that therapist or that mental health specialist won't be able to properly help you.
All right, no, thank you. And so on here, are parents informed if their child goes to see the therapist? And that kind of goes a little bit into the confidentiality piece. Will the parent know about this? That's a tricky question.
Yeah, so I can answer some of that, and for sure, everyone can add in and chime in at any time. So there's a law in Maryland. So if you are above the age of 12 and the person whom you're trying to seek help from, you have a conversation with them and they're able to establish, okay, well, is this student who's above the age of 12 able to understand what we're doing, what therapy is about, et cetera, then they can sign for themselves and the parents don't have to know. Now, ideally, as Lainey was saying, we do want to include the family, right? Because oftentimes there are different parts influencing each other. And so ideally we want to include the family, the parents, et cetera, grandparents, whoever it is at home. But in a way, they don't have to know if you're above the age of 12.
Right. I was saying it's a tricky question in terms of like what's going on, and like you say, we want to include the family if at all possible, and then of course if you have a child who's under the age of 12, then you have to get parent consent. But if they're 12 and up, then they could, if they're mature enough and they understand what's happening, they could sign consent for themselves for therapeutic services. And especially if, we have students, and I know I've seen examples of students in the LGBTQ plus community who don't want to out themselves. And so to their family at the time, because maybe their families are not at that place yet. And so they may be old enough to sign consent for themselves to get services. And in Maryland, you can do that. And so, but again, it's tricky because you want the parents involved.
Right.
Because a lot of times the reason why, maybe the student is there because there's things going on at home or things going on at school. And maybe if they got support from the family, things might get better. But we understand there are times when they do need to get help. And that they may not be at a place where their families can know, and they may sign consent for themselves. And so, in helping our families to know that, because that is the law. And so, and we have to follow the law, and what that law was put in place for a reason. And so, but at all possible, we want to work with our families. All right. And so, one of the questions on here, what if I know that someone is planning a suicide, and is there a hotline or a number to call? Jose.
So as I mentioned earlier, we have 988. A 988 is a free service. It is confidential. You can call, you can text, you can chat as well. And so in this space, you get connected to a trained counselor. And this person is there to help you talk through things if you're just having a bad day, if you're going through a crisis as well. Anything on the extremes and anything in between, this person can provide that help. And so you don't have to let anyone know. You can reach out in whichever way you feel comfortable reaching out, if it's through your phone, if it's through your computer, etc. And you can be any age basically. You can, anyone can reach out to the service, and it's free. It's 988. Very simple. Anytime, anywhere, 24/7.
All right, I know, and throughout our show, you may have seen the banner for the 988, right? So that's on there, and it's real simple, easy, 988. So at 3 in the morning, you can call or text 988, and so it's available, that resource that's there. And then, Manuel, we also have our crisis center.
We do, yeah. It's always open 24 hours a day, too. So
24 hours a day, that can go, provide support, if you or somebody who's suicidal.
Yeah, and we can show up at the house to do an assessment. Yeah, again, we go with police, without police. I mean, we're kind of going more in severe situations, so someone's actively suicidal, try to see what we can do from there, and we can initiate some type of treatment, whether it be outpatient or inpatient, if it has to go to that.
Okay, so again, we tell our community we got multiple ways of getting help if you have a friend who is having that type of need. All right, and so on here we got, sorry, I'm in here looking. So how can people find out which agencies are in which schools, and where can we look, or who can we go to find that out? So how can you go and find out if you're in the school?
Definitely. I would recommend going to info.montgomery.org. They have a section for mental health, and you can look at by every type of category of mental health, and you can look at what cluster in the county they're at, and then what schools they're at, and what they provide and things. And it shows contact information as well. So if you want to get that on the internet, you can do that.
Okay.
And for us, you can check out our website, everymind.org. And if you are in the schools, you can ask people around in the school. And oftentimes our suites and our offices, they have a big banner, they have a big sign that says, we're here, linkages to learning, bridge to wellness, SCYS, and so contacting the counselor, they can definitely point in the right direction, or our website as well.
Okay. And I know also with our Be Well 365 website, you can go on there and look and see, which resources are at which schools. We have a list that has, this school, Cloverly Elementary has X, Y, and Z, and Key Middle School has this. And so you can go on there and find out like what services and support are at your school. But also the school staff will know, like what are the services and agencies that are there. And so, and our goal, as you can see, hopefully, we have been working with all these agencies in order to have these types of therapeutic services in all of our schools. We're not there yet. We're very close. And so, and as always, with additional funding, we hope to expand to meet this need in all of our MCPS schools. But right now, I would say we're in the majority, and so, which is great. And so our goal is to continue to expand to make sure that we're there. So, all right, so one last question, and that what should you, on here, like, well, what can you do if you tell, a trusted adult, how can you go tell a trusted adult if you're having mental health concerns? Like, how can you go and, like, I'm struggling and I need help. How can I do that?
Well, there's lots of ways that kids reach out. One, sometimes is to tell a friend. And that friend can come to us. They can write a note. They can send an email. There's lots of ways that they can come, and certainly those adults in your building, those teachers and school counselors, they're there for you to help you get connected and to help you get the support you need.
And oftentimes, honestly, is because I know that sometimes as a student, right, someone can, adults are busy. There's a lot going on. There's like many different things moving for the adult pieces, but then oftentimes if as we as students, if we approach an adult and we might say something in a different way that we're normally used to saying, sometimes that can really be like, whoa, I never heard that before. So it could be like, hey, I have something really important to tell you. And sometimes that just catches the attention right away. Sometimes just kind of changing the wording a little bit. And of course, this is also comfort level because sometimes talking might not necessarily be comfortable. It can be very intimidating. But it can also be written as well on a note or maybe reach out through someone else as well.
Another idea is also you don't have to wait for the moment that you're in a crisis in the thick of it to reach out to someone for help. If there's ever a moment where you're just like, I'm confused, I think I might need help, but I'm not sure, that can be an opportunity to reach out as well. You do not have to wait till you feel like you're completely underwater before reaching out to try to get some help.
All right. No. And I know, like, since we're nearly out of time, as we're going through this, and, I just want to thank you all for helping and supporting us for our virtual Mental Health Awareness Week resource fair, providing great information about your agencies and the supports that we have for everyone. I just really appreciate, all of this and the support that you have there. And so, since we're nearly out of time, again, here's one final question for everyone to answer. What kind of mental health, extracurricular, or after-school activities can students get involved with?
Definitely everyone can join their Our Minds Matter Club. And if you are curious to know if your high school or middle school has an Our Minds Matter Club, you can either reach out to program@ourmindsmatter.org or visit our website. We have a gorgeous color-coded map that has all of our schools across the network, and so you can easily search for your specific school.
All right, thank you. So we gotta promote Our Minds Matter. So a huge thank you to all of our panelists for being with us today. Your perspectives and experience have been so valuable. And I also want to remind folks about the additional resources that are available for families on these topics, all available on our Mental Health Awareness Week website. Students, don't forget about those SSL hours, which you can earn by watching today's program or the videos on the website with SSL next to them. Then you just do a short reflection and submit an SSL form. And please take a minute to fill out the evaluation and survey. It means a lot to us. And I want to thank The Montgomery County School Psychologists Association, my staff in psychological services, and all the people behind the scenes in well-being, learning and achievement, communications, MCPS TV, MCCPTA, Our Minds Matter, and our panelists for your time to be with us today. And we want to thank our viewers for joining us for our virtual Mental Health Awareness Week resource fair. Be well, be aware, take care. Bye-bye.